topic today, as mentioned, is practical aspects of RTMS and clinical routine. I will shortly introduce our clinic, our experience with TMS, and then I will discuss with you the typical treatment course of an RTMS treatment of patients for the different indications. So I'm working at the Bezirksklinikum Regensburg, so it's a district hospital, but also university hospital, which means we have a large hospital with almost 500 beds, and with a task to take care of the inpatient treatment of the whole district. So that means that we have a non-selected patient population in our clinic. All psychiatric patients of the district that need inpatient treatment come to our clinic, and TMS is established in the clinical routine. So for almost 20 years, we have more than 3,000 patients treated, both inpatient and outpatient. We have also a large outpatient department. Over all the years, we have never experienced an epileptic seizure. We have 3 fully equipped treatment rooms, so different TMS devices. And also from the very beginning, we also evaluated the TMS treatment scientifically, have many publications on this topic. But it comes really from the clinical need, and over all the 20 years, so we were interested both in further developing TMS, doing scientific research, but also in using it in clinical practice. And I think the best way to introduce how to use TMS in clinical practice is to follow the course of treatment, and we will go through it and focus on the different moments when we see the patients first, when we start the treatment, every treatment session, what are we doing, who does what. For us in Regensburg, we decided that we try to have a very clear documentation of the treatment. We have case report forms for this, typically used in clinical studies. We also use it for our regular treatment of TMS, something that we have established only recently because we really want to evaluate every single patient. So we have developed a system that every patient has a case report form where all the documentation concerning TMS treatment is done. So at the beginning, the first contact with the patient is a screening visit. And the question is, who receives TMS? Which patients are referred to TMS? So we follow more or less the recommendation of the European guidelines of Jean-Pascal Le Faucheur. And A means that this is an indication where we have good evidence for an effect of TMS. So this is valid for patients with depression and with pain syndromes. Since we are a psychiatric hospital, the large majority of our patients are suffering from depression. It's only occasionally that we also have patients with chronic pain syndromes in our clinic. Among the patients with depression, which patients should we treat? Typically, we treat those patients who do not respond sufficiently to standard treatment, which means pharmacological and psychotherapeutical treatment, and typically as an add-on treatment to pharmaco and psychotherapy. We also treat patients with auditory hallucinations, with tinnitus, with OCD. Very recently also we started, but it's only in the context of a clinical study, we started to treat patients with increased impulsivity in the context of borderline personality disorder. So the next question is, who should not get a treatment with TMS?